Okay. Got it. All right. Is everyone all set then? Jamie, are we good to go? Amazing. Okay.
Good morning, everybody, and thank you for joining us for our harm reduction panel presentation this morning called Listening and Learning. We are recording this panel presentation just as an FYI. Only the panelists can be seen. So if you're joining us as a participant, you will not be seen on the recording, but just let you know that it is being recorded today. I am going to start this morning with a land acknowledgement. Sorry, I'm just going to get that down there. We acknowledge the land upon which we are located as the shared traditional territory of the Haudenosaunee and Anishinaabe peoples, protected by the Dish with One Spoon Wampum Belt. This historic peace agreement between the Iroquois Confederacy, the Ojibwe, and allied nations represents a commitment to share and protect the land, water, plants, and animals with respect. We wish to honor the original peoples of this land and express gratitude for the opportunity and privilege to work with communities across this territory. So I'll just let you know that this land acknowledgement, I'm in Brantford, and our catchment area is Brantford, Haldimand, Norfolk, Hamilton, and Halton. So that's the areas in which we're talking about directly. If you're coming to join us from one of those other outside of that catchment area, hopefully you can join us in your own land acknowledgement as well. Sorry, my dog back there. So just a little bit of housekeeping that we'll do quickly here. So we have two panels. So we're going to do our first panel this morning. And then we'll have a second panel of speakers that comes in at about 11 o'clock. We will be taking questions and the panelists will be answering those questions. But we have a half hour kind of set at the end of the presentation to do any questions. So please, if at any time you have a question, feel free to type it into the Q&A box. We have someone who will be monitoring those questions and we'll be asking them at the end, but you don't have to wait to the end. If you feel that you're going to forget it, please put it in at any point in time. And then we also ask that you respect our panelists and use respectful language in all questions and comments. So we just want to keep it very respectful this morning. In terms of support, because we will be talking about harm reduction and we'll be hearing some people's direct experiences accessing harm reduction services and providing harm reduction services. If you find the content of today's discussion disturbing or triggering, we ask that you please don't hesitate to take steps to take care of yourself. I've included the St. Leonard's Crisis toll-free number that you can call. This is the number that's in my area. If you're outside of our area and you're feeling a little bit triggered and you're not really sure who to call, please contact us and we'll certainly get you a line that you can call in your area. Because harm reduction covers a lot of different things. I mean, harm reduction is, wearing a seatbelt when you're in the car, and at the AIDS Network, we, talk a lot about condom use and dental dams and things like that. For the purpose of today's conversation, we are going to be talking about harm reduction in the sense of using substances. So I just have a little information here. So what we'll be talking about, harm reduction is a public health approach that aims to reduce drug-related harm experienced by individuals and communities without necessarily reducing the consumption of drugs. So harm reduction meets people where they are at, addressing conditions of use along with the use itself. So, Also, because we cannot see our participants this morning, we did kind of want to have a little bit of an idea of where people are joining us from and the sector that they're in. So if you feel comfortable doing so, if you want to introduce yourself in the chat, kind of where your name perhaps, or where you're working, just so we have an idea of kind of who's joining us in the chat. Feel free to do that if you'd like. Otherwise, I am going to introduce our first panels. I'm going to stop sharing my screen here. And so I'm going to introduce our first panel. And then after the first hour, when our second panel joins us, I'll introduce them at that time as well. So right now, our first panel is Jessica Molette. Jessica, if you want to give like a little wave on the screen, perhaps. Jessica is an adult nurse practitioner who specializes in substance use and addictions. She's employed at the Brantford General Hospital, where she provides substance use and addictions care to patients who present to the emergency department. As part of her role, she also provides education and capacity building for staff within the hospital regarding all facets of substance use and addictions, including treatment, harm reduction education, and community supports. Currently, she is working with a group in the hospital to improve harm reduction supply access for patients receiving care at the hospital. Prior to becoming a nurse practitioner, Jessica was a registered nurse both at the Brantford General and St. Joseph's Healthcare Hamilton hospitals, where she worked as an emergency department mental health nurse and on forensic psychiatry mental health units. Jessica has always had a passion for supporting patients with mental health and addictions concerns while working to break down the barriers and stigma these patients encounter. We're happy to have you today, Jessica. Also, David Jablinski, sorry if I got that wrong. If you want to give a little wave, David. David is a public health nurse on the substance use team at the Haldeman Norfolk Health Unit. Prior to this role, he worked as a registered nurse at St. Joseph's in Hamilton on the inpatient mental health unit. There, he provided care to clients on a concurrent disorders unit. This program provided a holistic treatment approach for individuals experiencing both addiction and mental health issues. He is also currently pursuing a Master of Health Management at Master University, hoping to increase his knowledge and skill set in leadership and project management. Thanks for being with us today, David. We also have Kate this morning. Kate, if you want to give a little wave on the screen. Kate Mcginnis graduated from McMaster's nursing program in 2016 and has a background in acute care, specifically in obstetrics and maternal health. She recently obtained her Master's of Education from Athabasca University, and she is currently a public health nurse with the substance use team at Haldeman Norfolk Health Unit. It's nice to have you with us today, Kate. We also have Rachel Goodland. Rachel, if you want to give a little wave, thank you. Rachel is a health promoter at the Grand River Community Health Center, working in the Brantford, Brant County area to support programs, initiatives around harm reduction, 2S LGBTQ plus health, social isolation, and other community health issues. She has been an active participant with the Brantford Brant Community Drug Strategy and continues to support a community application for consumption and treatment service. CTS is the acronym for that, in Brantford. Rachel obtained a Master's of Public Health in 2019 from the University of Guelph, where she focused her graduate project work on reducing public and institutional stigma towards people who use substances. Thank you for being with us today, Rachel. And last but certainly not least, we have Eve Dwyer. Eve, if you can give a little wave on the screen, thank you. Eve Dwyer is a mental health and addiction social worker at the Brantford General Hospital, primarily stationed at the BHN Rapid Access Addictions Medicine Clinic, also known as RAM, if anyone's familiar with that. Eve currently shares time supporting patients who use drugs with concurrent mental health concerns at the RAM clinic, the emergency department, and medical and mental health units. Prior to her current role, Eve spent time working as a part of the emergency mental health triage team out of the Brantford General, as well as mental health crisis assessment and support outreach in Haldeman, Norfolk. Eve engages with a broad spectrum of patients, working closely with individuals who currently use drugs, individuals who try to use less drugs, and individuals who are not trying to use drugs at all. Eve is passionate about harm reduction and has had the privilege of working with the communities of Brant, Haldimand, and Norfolk closely along many different areas of where they access care and support. In her spare time, Eve spends time hiking with her dog Bailey, has a passion for cooking and nutrition, and is currently training for her first half marathon. Good luck with that, Eve. Thanks for being with us. And I am also noticing that I don't have a bio here in front of me, but we also have Michael Shabib joining us from the AIDS Network. He is a harm reduction worker on our VAN program, the Haldimand, Norfolk, and Brant, but he is located mostly in the Haldimand, Norfolk area. He's excellent to work with. I don't have a bio here, but he's very approachable, super easy to work with, super easy to get along. Thank you for being with us, Michael. If you want to give a quick little wave. Awesome. So if everyone is ready, we will get started. So I have some questions that I will pose to the panelists. We'll get their feedback and their insight on these questions. And like I said, please at any time, put a question in the question and answer box, and we certainly will get to your question. So we'll get started, and feel free to whoever wants to jump in and answer the question, go right ahead. So the first question is, what does harm reduction mean to you? And what do you consider to be the fundamentals of harm reduction from a practical standpoint? Somebody want to get us started?
I can start with that if that's okay.
Awesome.
So I found harm reduction, although my time within the program is quite limited, it's an upstream approach to reducing risks associated with certain behaviors and activities. We kind of view harm reduction as the seatbelt of substance use. So we have different things that we do in our daily lives to reduce risks of certain activities that we can't avoid. And with harm reductions relating to substance use, with some people, the goal of their substance use isn't to become abstinent from the drug or to even reduce the risk of their use. Sometimes the goal is just to use the substance in a safer manner. So we don't want to completely try to always aim for sobriety with all of our clients. We just want to reduce the risk of their use and create these relationships that are built on mutual respect and trust and understanding. And that's the fundamentals of harm reduction in my practice.
Hi, Jamie. Oh, geez.
Yeah, no, go ahead, Mike.
Oh, okay. Do you mind if I did? It's similar. It's similar to what was already said. To me, like for the first one, like what does harm reduction mean to me? It's more about approach, at least from the way that I do my job, like on the van, right? It's about like meeting folks where they're at, no judgment, no expectations for folks to get clean. Like they determine that. I don't determine that for them. Not looking to report folks to different systems, whether that would be police or other systems. Not moralizing drug use, just looking at it as drug use. I mean, it's not good nor bad, or you know what I mean. It doesn't make them less of a person. And the provision of gear, it's like about letting folks decide what they need, right? Like the idea of, I want 10 pipes. Well, are you sure you need 10? Like that sort of idea, not doing that. And like minimal information collection, like not being intrusive when collecting information, when dealing with folks. We don't collect a lot of information on the van. In fact, it's very close to none, because what would be the purpose of that, right? Like, so at least from the way we provide our services. I noticed also that you threw in the fundamentals question with the first part, so I can add to that. Like as far as the van is concerned, it's about providing folks with like sterile gear, right? Whether that be pipes or syringes or Narcan or stuff like that. But from a larger vision, it's about what was already mentioned, right? Like advocating for safer supply of drug use, like taking street drugs and having a medical alternative, right? Like a more direct medical alternative, like Molette or something like that, right? As opiate replacement. Well, not opiate replacement, opiate for opiate, right? Because it reduces the toxicity, right? Medically prescribed drugs can be dosed suggest that that would lessen likelihood of overdose. Advocating for decriminalization of substance use, I think, is another significant part of it. And what else? Yeah, like consumption and treatment sites. I think I'm going to answer that question twice, but yeah, it really is like decriminalization, safe supply programs, and consumption and treatment sites. Really, like from a practical standpoint, above and beyond what I'm already doing. That's what it is. Thank you.
I'll go. I work in healthcare, and my number one job in healthcare is to like help people where they're at, address their concerns. And we know people use drugs. A lot of people use drugs. If you drink alcohol, drink coffee, whatever, you're using a drug. And harm reduction is this wacky concept that everybody is entitled to as safety in whatever lifestyle they're engaging in. We know people like going to people and saying, hey, stop doing that thing. Doesn't work. I'm sure dermatologists would recommend people to stop sun tanning and going out into the sun, but they know that's not realistic. So they recommend sunblock, or they recommend, whatever, hats and coverage of skin. And in terms of, the fundamentals question, two things really stand out to me that I think often get missed is like, one, harm reduction doesn't ignore the fact that there are these different spectrums of drug use, and that there's different risks along the different spectrums of drug use. It's not ignoring the fact that it is high risk behavior at times. And then also that people who use drugs are probably our best resource for learning how we can support them. Or support anyone really. So that'd be my 2 cents.
I can jump in next. So as a nurse practitioner, a lot of my lens comes from like the medical side of things and prescribing and whatnot, but in the emergency department, that's not always the case of what I can do. So somewhere at the RAM clinic every day, it's easy to prescribe medications for your clients. In the ED, people are coming in the worst day of their lives usually, whether it's an overdose or even an overdose because they took a bad batch of cocaine that was laced with fentanyl. So a large part of my role isn't just prescribing medications that can reduce the harm associated with using substances, but it's also providing that harm reduction lens and providing them with other support. So as coming from a medical model, it's been trying to build my own harm reduction kind of lens, and view is a big thing for me. And some of the fundamentals that I have focused on are building that trust with the clients that come in, especially since I do have a lot of clients who are kind of those repeat clients to the ED, and really meeting them at the level that they're at and providing them with the chance to empower themselves and make their own decisions. So if they come in and with an overdose, it's not just throwing, well, Suboxone and methadone, yes, are seen, they're very much a harm reduction viewpoint in a way that I can help reduce harms associated with our toxic drug supply. If that's not at a spot that they're at that point in time, it's just having that conversation and determining what level of care I can provide them, whether it's just connecting them with a resource or listening to them or providing them with supplies such as syringes and pipes and other things that could be useful for them. So that's kind of my viewpoint of harm reduction, is really just sitting with the client in the ED and giving them that time on their worst day possible for them, and letting them tell me how I can help reduce the harm with the substances they're using, and letting them guide the harm reduction that I'm providing to them.
I would just add briefly that coming from a primary care setting where we also provide a variety of other services, you don't have to be like a harm reduction service provider specifically to take a harm reduction approach. You can be a social worker, a nurse, anyone who interfaces with the community on a regular basis, and take a harm reduction approach by being non-judgmental, as Michael mentioned, by taking a neutral stance towards drug use, meeting people where they're at. All those types of strategies are a harm reduction approach and are part of that larger approach. And I think that's something that's not as frequently acknowledged, is you can be a practitioner or a service provider in any capacity, and there is a way to take a harm reduction approach in your practice. So that's just something I would add as an observation.
Yeah, I mean, I think everyone kind of touched on everything. You know, one thing when I think of harm reduction and kind of in my practice that has stuck with me, and again, I think this really comes down to using that individual approach for clients, is really the stages of change model. I think that kind of being aware of the fact that, you know, everyone may be in a different stage, and the stage that they're in today might not be the stage that they're in tomorrow, and, you know, or in a month from now, or in a year from now, and just really being aware of that, and, you know, just kind of understanding the fact that the resources or the interventions that you might provide someone when they're, let's say, in the pre-contemplation stage, or, you know, preparation stage or action stage, those can all look very different, and you really do want to tailor, you know, the interventions that you provide, or the support or the resources, to a client, you know, based again on where they're at. So really just kind of, again, approaching it at an individual level, and really listening to your clients, and understanding what their needs and what their wants are.
That's great. Thanks, everyone. Those are some good answers. And yeah, really good point, Rachel. You know, you don't have to be a harm reduction worker in order to, you know, employ some of the harm reduction tactics. So definitely things that can be employed in everyone's workspace, even if you don't identify as a harm reduction worker. So we'll go on to the next question. And that is, what are your experiences providing harm reduction services?
I can jump in and start. So one of the main experiences that I have are prescribing things like methadone, Suboxone, Cadian as a harm reduction kind of method. So in any capacity, prescribing those medications is a harm reduction method, because you're either the client wants to be abstinent from substance use, and so you're using that to help them remain abstinent from using opioids or other substances. And then in another respect, it's just decreasing their use, or decreasing their use of the toxic substances in our community. So by prescribing these medications, we're helping to reduce the chance of overdose, the chance of using the toxic supply in our community. And then on top of that, I do provide a lot of like harm reduction education in the emergency department regarding our toxic supply. I have a lot of clients who come in who are actually not opiate users at all, and are coming in with fentanyl overdoses because of cocaine being laced with fentanyl. So a lot of my work is education around this toxic supply of other substances, and how to protect themselves. So making sure that no matter who they are and what substances they use, that they have naloxone on themselves or around them, and that they're not using alone, to help prevent those overdoses. And then additionally, I start to provide harm reduction supplies in the emergency department, such as clean syringes, clean pipes, those kind of things. And I'm working at the hospital. The hospital has a very limited supply of these things, and very limited people who actually hand them out. So I'm working with a group at the hospital where we're actually going to be getting a steady supply of these supplies that we can give to clients who are registered at the hospital. So we can have more harm reduction strategies and education and supplies here for clients who do require them while they are here. So that's kind of my experiences so far.
I'm going to piggyback off Jessica, because I actually collaborate with her a lot in hospital, and am also working with her on that group. And in terms of my experience, I do hand out clean supplies both at RAM and in hospital when able, same as Jessica, clean pipes, clean syringes. Also knowing that like clean water is a harm reduction supply, or specific types of foil, or like alcohol swabs. Like even if, as Rachel said earlier, like there's definitely different comfort levels, and like you don't have to say, hey, I'm a needle exchange program, but it can start with like giving people some clean water if you know that they're injecting, or just allowing them to create sterile environments for themselves. But also for within the hospital, especially, there's often like there's a lot of stigma around drug use in the world. And I think a lot of my experience with harm reduction is like slowly letting people know that I'm a safe person to share that information with, and I'm not gonna like be jumping down their throat with what they should or shouldn't be doing. And that doesn't happen in one conversation necessarily. Although when it does happen and they kind of are able to realize that you're maybe a safe person, that's a great moment and a great feeling. But that's a big piece. It's kind of through education and like through just conversations, letting people know that it's safe to discuss a part of their life with you. Like, it's not just the same as saying, I went bowling. Bowling is dangerous. So, like, tell me about it. And what can we do? We'll put the rails up. Like, we'll talk about harm reduction methods. So that's me.
Is it all right if I just kind of piggyback actually off of Eve as well? So just going off of those conversations, when I did work in hospital, I worked with mums and new babies, and specifically in labor and delivery, and creating that environment where you are that safe person for people to reach to in those vulnerable situations is so vital. I did work at a time in Brantford in labor and delivery, and we'd have mums who would be using methadone or were previous users, and just going into that room and approaching them as though they are just their equal. It's, you're here because you need to have a baby, and I'm not judging your past. I'm grateful that you're here. I'm here to help. How can I best help you, and how do I create that non-judgmental environment is just so important in building trust, and that's how you can actually create meaningful help and meaningful change within their life. In terms of providing kind of harm reduction services within the community, it obviously has been a bit difficult with COVID, but in those limited interactions, just creating real human connection, I find is just so vital to establishing trust and helping people kind of overcome those obstacles that they're facing in society. They beat themselves up enough. We all beat ourselves up enough as individuals. You don't need more people kind of adding on to that. So just building off of Jessica and Eve is just, these people are people. You don't need to judge them based on what they've been through or what they're currently doing. We're here to help, and that's what they need to realize, and everyone needs to realize, is that we're all struggling and people deal with struggles differently. So how can we help you best?
I can go, Jamie, if you don't mind. Like this is like as far as like delivery service, my response is predominantly about the van. Something interesting about the van and the mobile service is that it actually is majority female. I'm not sure if folks who access the van, I'm not sure if folks know that or not, because I think there's an extra layer of stigma, right, for women who use drugs. And we've been told by them that like they're reluctant to access fixed sites, because of stigma, judgment, their caregiving responsibilities, that they can't simply just leave the house and go to a fixed site to access gear. And like, because it's Haldeman, Norfolk, and then Brantford, we do deal with a lot of smaller communities, right? So the idea of folks being outed, like there might be one pharmacy in that community, right? And places fixed sites to access gear are extremely limited through Haldeman and Norfolk specifically. So the van really might be their only option. But it's it's been really well received. I think folks were a little apprehensive at first because it was kind of hard to believe that, transportation being a big barrier for folks out here too. It's hard to believe that that was addressed, right? And they could come see us and there's no obligation on them. In fact, they just help if they want and we provide them with it. And I think like it's been really good service delivery. I would say definitely like mutual relationship of like, you know, trust with the people we serve for sure. Yeah, that's about it. Thank you.
Yeah, so in terms of current work, I'm one of the staff at Grand River Community Health Center who's working on a safe consumption site or CTS application for the Brantford region. It's challenging to establish a site for many, many reasons. And yeah, that's one of our major projects right now at the health center. The other thing we're working on is distributing harm reduction supplies, similar to Jessica, as part of our brand new medical van program, which is exciting. And we have a small naloxone program as part of like our outreach work as well. So that's kind of some of the work at Grand River that's going on that I'm supporting. Additionally, in the past, I did some anti-stigma work in Hamilton around particularly institutional stigma towards people who use substances. And I just wanted to add that it's nice to be in a panel with so many service providers who are the opposite of what I have encountered in various settings. So yeah, overall, that's some of the work that has been done and is being done. Yeah.
All right. I definitely, I mean, I think kind of going off of what Kate was saying as well, with especially in the last couple of years, with the pandemic happening, I think a lot of resources, obviously, that normally were kind of up and running or being provided, there was definitely met with challenges. We still at the health unit have been kind of providing resources kind of as we can, still based on kind of the operational needs of COVID, but you know, ensuring that we are tracking kind of and monitoring what is happening in the community. If there is something that kind of is certainly alarming, sending out kind of information to the community members to ensure that people are aware if you know there is a substance that's in the community that's showing to have an increased rate of overdoses. You know, we definitely would want to provide that information, as well as continuing to provide clients with safe supplies at the health unit. And I think that's in my kind of even previous role working at the hospital, I really did kind of see the importance of, you know, when someone was in the hospital for substance use and sometimes connected with mental health issues as well. Just the importance of, you know, ensuring that the support that they were being provided with in the hospital, that they were also connected with supports upon discharge as well, making sure that those were the right supports for that individual. Again, kind of keeping in mind that what works for one person might not work for someone else. So really trying to find the best resource that's available for that individual.
Great, thanks everybody. Really awesome responses, and I think it just goes to show just how much harm reduction work entails. You know what I mean? You all identify as harm reduction workers, but are all doing some very different work in the community. So you know, one size certainly does not fit all in terms of people who are accessing harm reduction services and for people who are providing harm reduction services as well. So really great. I just want to take one little second and acknowledge the participants who took a minute to introduce themselves in the chat. We have a lot of different people from a lot of different areas. So thank you again for tuning in today and letting us know kind of where you're joining us from. So we'll get on to question number 3. What are the benefits and the challenges of harm reduction in your workplace?
I can kick it off. I think one of the benefits, not just in my workplace, of harm reduction in general, is that so many folks who traditionally have access services and met a lot of pushback, criticism, judgment, when you take a harm reduction approach in general and establish some trust, folks are able to come to you for support when it's needed. And I think it's so important to help people prevent like further, I don't know, injury, illness, risk, social isolation, in establishing that positive relationship and taking a harm reduction approach. So I think in general, just having an open door is a wonderful start when it comes to harm reduction, and is so beneficial. Some of the barriers, kind of like the other side of the coin, is I find there is a lot of public stigma towards both people who use substances and harm reduction as a practice. And that can make it difficult for, like Michael was alluding to before, for people to access services the way they would like to access services. And that's something you definitely have to work around and work with people to kind of address it, because it's an ongoing issue and it's a huge barrier for folks who are looking for any extra support. It doesn't matter what it is. It's very, very hard to take that first step and access a service or support if you feel like there could be judgment coming your way. So yeah, it's interesting because the harm reduction approach is about reducing judgment, but to get people there is difficult because of societal stigma. So yeah, that's my 2 cents.
Just building off of what Rachel was saying, it is so hard to address that that stigma that's so ingrained within society. I found a benefit within our workplace at Haldeman Norfolk Health Unit to try to avoid that stigma was providing widespread training to not just public health nurses or harm reduction like health promoters particularly, but to all members of our team. So that's been very beneficial to have just that training and that knowledge of how to use naloxone, how to give out safe supplies, and to interact with the clients that we see. So it doesn't feel so much that you have a client come in who's asking for safe supplies and they stand there and you wait with them and kind of have that uncomfortable interaction while you wait for a public health nurse. We're able to build those conversations and relationships with our caseworkers, with our customer service reps, in order to just build a safer place for people to come when they need additional help, which has been so beneficial. One of the challenges, not so much in regards to stigma, has been the pandemic, of course, and creating those interactions between clients and the health unit in a way that's safe in regards to infection control, while also trying to create trust and a human interaction and connection in a time when everything felt so alienating was definitely a huge challenge just within the past little bit, especially in earlier January of this year when it felt like we were kind of starting all over again at the beginning with the pandemic. It definitely put quite a big strain on being able to provide those services that we desperately want to get back to.
I kind of want to, so being in a hospital, it's definitely, you really see the institutional stigma that Rachel was kind of alluding to earlier, especially since I came into this role that was completely non-existent in the hospital. There was, in terms of addiction care in the hospital, there was providing social work addictions care. There was a few doctors who would do it kind of here and there, but really addictions care in BGH was very, very limited. And then this role came about and I helped build the role. And so you see a lot of the institutional stigma that kind of comes along with addictions care in a hospital, and how much of a barrier that is to providing care So not only when it comes to prescribing medications that can help reduce harm associated with using substances, but also with providing them with our clients with the supplies that they need at whatever stage that they are in the hospital for. A lot of comments, a lot of pushback, a lot of I'm not comfortable giving that because we're gonna set these clients up for failure, or we're gonna encourage them to do things that they shouldn't be doing, instead of actually just realizing that we're actually supporting them at the journey that they're in and helping them on that journey and giving them the care that they actually need. We're not doing anything negative. We are supporting them with what we can support them with. And so it's been a lot. That's been my biggest barrier in the hospital with harm reduction and addictions care in general, is the stigma that comes with it, and pushing through that stigma and really educating and building the capacity about why harm reduction is so important for these patients, and why and how we can actually support patients where they're at in their journey, without saying you have to stop substances, or without demoralizing what they are doing, because that's not what we're here to do. We're here to support them. And so that's been my biggest challenge in the hospital with harm reduction in general at kind of any facet.
I'm gonna ride that hospital way. I'm sorry. I'll try not to talk about the hospital so much, but in hospital, there's a lot of often complications from substance use, or people get sick for other reasons, and they end up in hospital. And it's a pretty hard and fast, don't use drugs, or you know, I'm not going to say, or you can't stay here, but it becomes a very difficult piece of providing care, in the sense that it's very black and white. Now, I don't want to like harp on our care providers, because they're, you know, like it introduces risk. Don't do it. Stop doing it, because it's going to hurt you more. And then we can, it's frustrating for care providers when we can't help. But it's kind of we're at two different sides of the court, and a lot of the work in the hospital, a lot of the challenges around, again, like these frequent small conversations and challenging around, you know, why people engage in certain behaviors, and small ways that we can accommodate them staying in hospital to receive, you know, care for their heart infection. So, you know, like, because if we're not able to accommodate that, they will leave to probably access what they need. And then they're at higher risk of further health complications. The greatest benefit of harm reduction for me is that my patients die less and my patients get less sick. And, you know, and Rachel, excellent point. When they come to you. So I know that you mentioned the consumption and treatment site, which is kind of this, you know, providing a safe place for people to use substances. There's no evidence that this increases substance use in the community. And in fact, there's a lot of evidence showing that it increases the chance people are going to have close access to supports to eventually move towards safer, maybe reducing, maybe stopping. But ultimately, you know, the evidence is good that it actually helps people be closer to the things that they need, and have safe relationships with providers. So that's something I've definitely found, is that, like, people will come to me when they don't go anywhere else. You know, maybe they are going to their family doctor, but they're willing to come to me. I can't do what a family doctor does, but I can certainly help them get closer to getting to that help that they need. But yeah, really good points from everybody.
I just wanted to add quickly as well that in terms of barriers, a lot of us are doing the work we're doing because of some barriers around policy and legislation. Like, a lot of our work exists because of poor public policy that is contributing to the drug poisoning crisis. So I think that's a huge barrier. The other thing is establishing things like a safe consumption site and safe supply programs, which are prescribing programs. There's a lot of legislation around medicalizing models for these services. It's very difficult to establish these services and to obtain funding, things along those lines. So I just wanted to add that that's a very, very large barrier in a lot of communities. And it makes it difficult for folks like us to provide services that we know are needed and that people who use drugs in the community are saying, please establish these services. It makes this really difficult for us to respond appropriately. So I just wanted to add this larger macro concept of policy as a barrier.
I kind of want to add to what Rachel was saying there, just because something you mentioned was that my observation throughout like being part of the band is that service users, as far as like knowledge goes, they tend to be slightly ahead of service providers. That's not to put down service providers or anything like that, but like the idea of a safe supply program, right? You already had like significant, no doubt, significant buy-in from folks who would act, or if it's a consumption and treatment site, like when I'm addressing like groups and stuff like that in different facilities, that's driven by service users. They bring that into the room. I don't even bring it up. They'll say like, why don't we have a consumption and treatment site? Why don't we have a safe supply program? So it's quite interesting, right? And I'm just stuck there with the barrier saying, well, these are complex and it takes time and there is initiatives, and, particularly in the area where I live, Holland and Norfolk. Another deficit, this is pretty simple. Well, to speak to the benefits, I mean, it's obvious like public health outcome, like positive public health outcome, but for deficits, lack of fixed sites, like service providers are willing to have us into the space and talk to them about harm reduction and stuff like that. They make really good about that, but the actual part of like the vision of like handing out gear to folks, that's been challenging, super challenging. Maybe just keep at it, right? But it's more challenging than it needs to be as far as I'm concerned. But all right, thanks.
I think I'll just kind of, I mean, pretty much echoing what everyone has already said for sure. I think, I would definitely say like stigmatization, kind of as everybody mentioned, I think it's definitely seen in really in healthcare in the community. It's still something that requires a lot of work and trying to minimize that, and kind of again working with Kate at the health unit. I mean, definitely in the last couple of years, I think we've certainly seen just the challenges with the pandemic and with all the work that has been kind of needed, the emergency responses and all that with the work for COVID-19, and I mean that kind of, I would say, also just overflows into every area of healthcare. I think that the pandemic really has put strains on every area of healthcare, making the kind of regular programs that we were providing prior to COVID definitely increased the challenges that were already there, and I think made them a lot more kind of visible and increase those challenges. And with regards to the benefits, I mean, I think that everyone kind of has already mentioned all the stuff that I would have mentioned, but just for us, even here at the health unit, I think being able to kind of create those rapport with clients and again understand the needs and the wants within the community, ensuring that there is an access to safe supplies, and also increasing our relationships with stakeholders in the community to kind of see the best ways that we can provide support is definitely kind of some of the benefits of us having the harm reduction program at the health unit.
Great, thank you so much. Thank you for the honest answers. I know it's not always easy to talk about the challenges that we face in our workplaces, but I think that it really added a lot to this conversation. So I really do thank everyone for their honesty in that answer. We're going to have the last question now for this panel. So panel number 2, if you want to just be prepared that we'll be talking to you after this panel answers this last question. So finally, what advice do you have for service providers doing harm reduction work or starting new harm reduction programs?
I can start. my advice is to not be discouraged. It has been a challenge, to say the least, starting this role and now working on a harm reduction program here at the hospital. There's a lot of stigma and judgment associated with the clients we're working with, the work that we're doing ourselves, all of which is unnecessary and completely not rooted in any evidence. But to not let that stigma and judgment discourage you from doing the hard work that you are doing and the work that you are doing to make a difference in other people's lives. The work we are doing as harm reduction workers and addictions workers is saving people's lives and is making a difference in people's lives. And so to remember that when you are pushing through the tough pieces, and to not let it discourage you, and to just remember that providing harm reduction education and advice to someone who uses substances is no different than a parent telling their child to wear a helmet when they ride a bike, or telling their kid in high school to wear a condom if they're going to have sexual intercourse. So it's really all rooted in that same kind of evidence, and to remember that that's what we're doing. We're helping make a difference, and we're helping save people's lives, and we are providing that touch point for clients who otherwise wouldn't have it or have been discouraged from using healthcare systems because of the judgment and the stigma. So just to continue pushing on and push through.
Yeah, I would say it's really hard to do harm reduction wrong if you're putting an effort towards it. It's not impossible, but I think that if the intentions are good and you're looking into, what small ways can I start to support safe use? If I know that I have clients or patients who use drugs, like even just having conversations with them about what would help you and what would work for you. We have a lot of resources. Well, we don't have a lot, but we have resources in Brantford and Norfolk to help with safe supply. We have an excellent group of people here who I'm sure would be more than willing to answer emails and questions. I know I would. And I think just knowing that we know that rapport is like 80% of responsible for therapeutic change. So being able to have conversations with the people that you serve, just again, letting them know that you're on board to talk about using drugs, that's it. Like even just talking about it, as Rachel said, it opens the door. Like even if it's just, just a key in the door, then that's a good place to start. And you'll find that you're better at it than you think you are. Once you get going with it, that's what I would say. And reach out to other providers in the community who are practicing with a harm reduction lens, and see what ways you can start breaking into that space, because it keeps the people you work with safe, and it helps them work with you more, and you get more done because they want to work with you. So there's no downside.
I agree most with what he said. Pretty much what he said specifically. The only thing I'd add is consult. You might want to reach out to folks like us for advice or anything like that, or any gaps in knowledge we have of providing such services. But I think also, and this is something I do, and I believe all the dance staff does, is continually asking the folks that we serve, like if we're doing it properly, like soliciting that active feedback from folks who use drugs, is there anything you'd like to see us do differently? Do you find that there's fits for you? Do you find it meets your needs? Stuff like that, right? So, and it's informal. These aren't large surveys or huge amounts of data collection. They're just honest, sincere questions asked directly to folks who access the service. But I found it to be really helpful. And I find if the rapport and the trust is there, like you were saying, it will give that honest feedback. Following up for that. Thanks.
Yeah, and I mean, I just kind of even I totally agree with reaching out and kind of getting feedback and really trying to figure out what would be the best resources and support for a specific, community, even at large. Harm reduction, I think, oftentimes is very individual, but kind of taking a look at it from a public health standpoint and maybe kind of looking more at a population level, completing that environmental assessment, seeing what resources or interventions are necessary for a particular community that could look very different from a neighboring community or just a different community in general. So I really think that listening to your community and understanding what the needs are there is also just something that's really, really important and a huge resource for creating any type of intervention or any type of service that would want to be offered there.
Just to go off of David as well too, I think using lived experience to kind of guide our decision making and how we offer services, and also like Michael said as well, is so crucial to providing meaningful options for our clients. As people who have had lived experience, they're the ones who are actually utilizing these services. So we want to tailor these services to what they actually need, as opposed to just trying to guess what we think they need. And I think that's a big part of too, is just breaking down that stigma, not saying, I think you need to do A, B, and C, actually getting their opinions and ideas and values of what is important to them and what will make their lives and their journey meaningful and useful.
I'd like to add in one last thing, Jamie. Oh, geez, Rachel, let me cut you off.
No, go for it.
Okay, so it's just one thing anecdotally that I've noticed, like being at tables and stuff like that historically. A lot of times when implementing harm reduction strategies and stuff like that, or provision of gear or whatever, there's an unnecessarily large amount of time focusing on the wishes of folks that don't use drugs. So like they, focus on the community at large that are materially impacted by it, to be honest. And I really don't feel that voice has nearly as much value as the voice of a person who actually would use the service. You know what I mean? Like if a person doesn't use drugs or wouldn't use our service, like it's really here nor there how they feel about it. I mean, I would talk to them, of course, and with a great amount of courtesy. But of course, if you don't need, mobile access to harm reduction gear, you wouldn't support our service, and that's fine. But you know what I'm saying? I don't know if I'm quite articulating it. Perhaps Rachel can clarify the message if you help me out. But it's just like the idea that there's just this focus on the community at large and not enough of a focus on the community that's impacted. That's specifically what I mean.
Yeah, I think I can echo what Michael is saying, in that there's a lot of tables for a lot of things. And this is like, I'm not even specifying a community when I say across the board, not a lot of those tables prioritize lived experience. And I think there's a lot of bureaucracy that goes into like planning some of these programs, and it's often unnecessary. I think what I've learned, because I've been a participant in some things in the past where I'm like, we could have probably just started that within a few weeks and it would have been fine. So I think one thing that I've really learned when trying out new programs and trying to respond to community needs on an ongoing basis is that it's probably just better to start something and then change it. And get ongoing feedback than it is to have these tables for many months. And sometimes there's other things that make that necessary, because if you don't do this, then you can't apply for that, so to speak. But yeah, I think a lot of people in the general healthcare sector or the social services sector are used to sitting at a bunch of tables, participating in a lot of committees, and then seeing very little things come out of that, or very incremental change, when in reality, it could have been like one organization and some like really savvy volunteers could have started something within a few weeks. That is the biggest lesson I think I've taken from my last few years working in at the community level. And there's also just so much knowledge in the community, I find the more I talk to people who use substances, or people who are friends and family of people who use substances, is that there's a lot of work already being done in the community that as service providers, we don't even know about because we're not asking. There's people who have been supporting each other for many, many years. They've been doing their own version of safe consumption sites, like they're responding with naloxone in apartment complexes. Like, this work is already being done and is being done effectively. And I think we just, as organizations and institutions with resources, I think we can just kind of support that work. We can do simple things and see where it takes us. And it doesn't have to be these large, very arduous processes. So that's the advice I would give to organizations trying to begin harm reduction work, is certainly to just try things, to do and support the work that's already happening. And if you make mistakes, you make mistakes. That's all right. It's a lot better than working on things for many years and then not seeing that change, for sure. Yeah.
100%, 100%, all of that. Just get going. Just do it.
Thanks so much, everybody. Great conversation. I really thank everyone for taking the time to answer our questions today. Look at us being on time. We're just at 11:03 right now, so this is really fantastic. I am going to ask, we're going to transition to the second panel now. So if our panelists from the first one can turn off their cameras, and panel number 2, if you can turn on your camera so we can see your lovely faces, that would be great. And I do believe that we have one individual in this panel who is joining us by telephone, so we will be able to hear them, but we won't be able to see them. So I think that I actually forgot to introduce myself at the beginning of this, so I'm just going to say really quickly that my name is Jamie and that I work for the AIDS Network as well. And I'm the health promotion and risk reduction worker covering the Haldimand, Norfolk, and Brant area. So I do more HIV education and prevention, but there's a lot of harm reduction work that goes into that as well. So I am going to get on our introductions for our second panel now. So today we have Jamie, and Jamie is joining us on the phone, so waving virtually at us, I'm sure. Jamie, as someone who has always had compassion for the people, Jamie has always strived to be a voice of the people. So it's no mystery that the podcaster who got her early starts doing the school announcements and participating in plays, as well as discussions with the student government, she is a stranger to very few and a familiar face to many. Currently working with Keeping Six as a peer investigator, and also recently joined Brantford Ministries Board of Directors, Jamie hopes to inspire a legacy of confidence and strength through empowerment of her people. Thank you for joining us today, Jamie. We also have Deborah Hill. Deborah, if you want to give a little wave, hi. Deborah Hill was fortunate to be in between two reserves. Her mom was from Credit of the Mississaugas, and her dad was a Tuscarora from the Six Nations of the Grand River Territory. She is registered as a Mohawk. While trying to further her education and raise her children, Deborah became addicted to alcohol and drugs and struggled with addiction. Deborah went to Addiction Services Initiative at the Ontario Works office, where she was connected to programs, recreation activities, YMCA membership, and many other supports. Deborah started attending and volunteering with the Brantford Brant Drug Strategy meetings. She has completed a college degree in Indigenous wellness and addiction prevention. She is currently working the van part-time. She is a peer support navigator, providing people with supplies they need: syringes, pipes, bowls, condoms, and whatever else they require at the time of calling. No judgment, no questions, just support. She has been a member of the Brantford Community Advisory Board for Homelessness. She has taken baby steps over many years to change herself. Thanks for being with us today, Deborah. And Charlie O'Neill. Charlie, if you want to give like a little wave, hi. Charlie O'Neill is a resident of Simcoe, Ontario. He has 27 years of lived experience in his addiction and a history of trauma. alcohol, and drug use. Throughout the last 10 years, Charlie has been serious in his recovery and has an amazing partner who is 100% part of his recovery. His recovery has had many ups and downs. He is proud to say that he is clean and sober. Charlie loves work of the AIDS Network and believes his purpose in life is to help those affected by addiction and trauma, as he is living proof that there is hope and the chance to regain everything you had saw as never attainable. Thanks for being with us today. And then we also have, I have this somewhere else. We have Jordan joining us as well. Give a little wave, Jordan. Hi. Jordan has been living with addiction for the past 15 years. He has accessed support in the past from the AIDS Network van. He got involved with the AIDS Network through his wife, who is part of the staff. He is excited to share his experiences with harm reduction and addiction today. Thank you so much for being with us. So I am going to get started. So again, it's the same setup that we had in the first panel, where I will pose the question and you can kind of jump in to answer it as you see fit. So we will get started. What does harm reduction mean to you? And what are some important messages about harm reduction you want to share?
I'll go. Yep. Harm reduction to me is safe use, letting people know it's okay and to just be safe using it. I unfortunately didn't have a lot of access to it in my abuse, but I love what they're doing now. I don't know if that answers it for you, but that's how I feel about it. That's it.
Great, thank you.
I'll
Anybody
jump.
else? Yeah, go ahead.
Yeah, I struggled with substance abuse for 15 years. I've been clean for 2 years. So I just wanted to mention that. So harm reduction to me, I think, is meeting people exactly where they're at, with no stigma or judgment attached to it. Definitely, absolutely no consequences, because there's many resources out there that you can access that come with stipulations or strings attached that just isn't right. It's not really truly loving that person and meeting them where they're at and loving them through that process.
Great point. Thank you, Jordan.
Harm reduction is like pain reduction, right? Just to update, I now work for the St. Leonard Society with the BDOTs. It was fun working on the van, and I learned so much from the crew, and I appreciate the work. And harm reduction is to be able to maintain and have our dignity not broken, be able to keep a rise with people. Education, right? We need to have people to understand of what it is actually. Greeting people, right? Greeting the day so that your day goes well. So, wake up and greet the day. So, and empowering ourselves. Somebody had mentioned that, empowering. Because it's a financial barrier too. So it's the harm reduction supplies that's out there helps out a large. Also, the needle suites doing community cleanup. It's not only a community engagement, but you're making friends, cleaning up Mother Earth, looking out for the next generation. And it's also a human right. And that's all I got.
Thanks, Deborah. Jamie, did you want to add anything? You're on mute, just in case you are speaking, we can't hear you. Okay. I will go on to the next one, and Jamie, if you want to answer after, just to reiterate, you are on mute, just in case you are speaking and we can't hear you. So the next question is, please share some of your history using substances and your experiences, accessing harm reduction services. Anyone can feel free to jump in here.
Yeah, I'll jump on that. Using drugs for 15 years, there's many stories, but one that really comes to mind is this one time I left the hospital and I asked them for a needle. It was like, I just overdosed. It was like Sunday, late. The pharmacies were closed. I knew I wouldn't be able to get any using supplies. And they said, no, we can't do that. It's against policies. So I knew I had this needle in my my backpack, and it was like super dull, like so dull that you could hear it pop through your skin. And whether that was safe or not, facts are I was going to use it, because that's just the state you're in. There's no way around it. I'm going to put that drug into my body, whether it's safe or not. And that's just where it's at. So not being able to have safe supplies coming from the hospital kind of blew my mind, because it's no different than, let's say, if you're a diabetic, if you eat 100 donuts every single day and you get diabetes from that, you go to the hospital. That was a choice. You chose not to take care of your body, got diabetes. When you leave that hospital, they're gonna say, okay, this is your insulin. Here's your insulin syringes. This is how you're going to take care of your problem. And it should be no different for drug addiction. I made that choice to use drugs. Why don't I get the safe choice to use that substance? So it was really hard before the vans started popping up and stuff like that. So once I started accessing the vans, it gave me more opportunity to save supplies. Eve mentioned the water. I believe it was Eve. That's like a key thing, because like I've been out in the streets and I've literally picked up a handful of snow and melted snow in a spoon, and snow's dirty, contaminants in it. It's not supposed to go in your body. So something so small as water is such a key to harm reduction. So being able to access these resources, it's life changing. It gives everybody the opportunity to be where they're at in their walk, and to have a fighting chance, just like the next person, just like that person with diabetes.
Thanks, Jordan. Great points. Go ahead.
In my time using, there was a lot of stigma. I felt I was judged all the time, no matter where I went. At a pharmacy, getting my meds, the girls would just toss them at me. They wouldn't pass them to me. They would toss them because they were painkillers. And the same as Jordan said, in a hospital, since I've been clean, I have been treated very rudely a couple of times in Simcoe here. I have COPD, and I'm also ADHD, so I take Adderall for that. And I was in Emerge, couldn't stay awake because I was having poison enter my bloodstream from carbon dioxide that I don't breathe out because I retain. And the nurse asked for a urine sample. I gave it, and she came back into the room shaking these papers, yelling at me, saying, "You're nothing but a fucking crystal head addict." Sorry about the language. I have the proof. And it's because Adderall was in my system, she assumed. So things like that are happening all the time. So when I hear the doctors and the nurses on this panel today talk, it makes me feel so good knowing that there are some voices out there pushing people, but in the end, it's people need to change, because it's so uncomfortable for people like us. It's just a constant reminder that, I'm no good. I've heard it my whole life. And again, you fight to get clean and sober, and you continue to hear it. And it's just lack of education. And it needs to be fixed. And what the van's doing and all this work and what Jordan said is just amazing. And I wish more people would listen. I see you're recording this. Maybe it can go out as a teaching tool to hospitals and nurses and that don't know. Because, you know, some of them just don't know. Some of them do, some of them don't. So I think it would be great to for this to get out there and people to really see the stories that people deal with. Thank you.
Thank you. Jamie, it's nice to see you, have you back. I can repeat the question. I'm not sure when you popped on, but we're answering. Please share some of your history using substances and your experiences accessing harm reduction services. So Jamie or Deborah, if you want to add anything there, please feel free. And Jamie, I'm sorry if you're speaking, you're just on mute. So if you can unmute, that'd be great.
Okay, finally. Sorry. My story goes back a couple of years ago. I was, I guess, at a crossroads. Me and my friends, we weren't talking so much, and I connected with somebody out in Brantford. Yeah, we used drugs. We also helped facilitate and connect a lot of people. And so when I kind of started accessing the AIDS network, I would get supplies. Then I'd bring them back to Brantford so my boyfriend and his clients would have safe supplies. And from there, I just began to start seeing like the compassion necessary in the administration of that kind of stuff. And I started meeting and connecting with really good people. And unfortunately, the relationship dissolved, but I began to understand that there's so much more to the stigma of being a drug dealer, and trying to like bureaucratize it or like officiate it in like a professional capacity is difficult but very necessary. And I got to see how many people he actually helped.
Awesome. Thank you, Jamie. Go ahead, Deborah.
And people suffer from anxiety, social anxiety. So having that stigma against them, it's just another barrier. We put so much labels on ourselves. It's just not helpful. Trying to get out of our shells, right? And I wouldn't go and ask for any supplies, or I wouldn't even ask for any of the substances myself, because I was self-stigmatizing myself. And that is a big barrier, is just to admit in the first place, before you can even move on. So that was one of the things I wanted to mention. What helps is that the stable and constant people, the constant help, without the judgment, the language that's used, and just having the service providers know that sometimes the having appointments don't necessarily work. Sometimes that need services during the night time, not just 9 to 5, Monday through Friday, but we also need the services on the weekends too, and throughout the night. So I think that's another shift that's going to have to happen. And just availability of some like drinking water, some candies, or, you know, something to take into with the substances, or in family connections, hopefully that everybody can resume their family connections, because it's a barrier as well. In education and sterile supplies, yeah. Yeah, the safe consumption site would be a huge help. That's it.
Great, thank you. Yeah, a lot of these things maybe sometimes, we take for granted. So it's really good to have this stuff really brought to the forefront, and so real meaningful change can happen, and especially in a lot of these bigger institutions like hospitals and places where maybe generally people have felt stigmatized in the past. So hopefully this will be a small little conversation in the grand scheme of changes that certainly we need to see in this sector. So the next question is, what challenges have you or people you know experienced when accessing harm reduction services? This will be really helpful feedback to have, especially for people who are looking at starting a new harm reduction service or who are currently working in them. So please jump in whenever you.
Sorry, could you repeat yourself? Oh,
yes,
cool.
Sorry. I'll repeat the question. What challenges have you or people you know experienced when accessing harm reduction services?
I think it needs to be out there more. Like the van's there, which is great. And I've seen, I get like from a Facebook feed, I'll get from Bobby Joe, vans in, Simcoe today. That's awesome. But I mean, like flyers, I'll post flyers anywhere they want. Like people need to know, because I've been at RAM volunteering, and there's people in there that don't even know some of the services that they are like, that they can get. They don't even know they exist. And it's not just from the van. I'm talking like ODSP, cabs, the shelters, all kinds of information that people don't even know exist. And that was really, really sad to me. I took a girl down to ODSP and helped her get cabs, and she didn't even realize that she could do that. So maybe that's not the van, but it's still harm reduction. It's going to save her from walking, getting to appointments. So getting it out there, I mean, I don't know how we can be better, but I know not a lot of people have access to the internet or a phone. So I'm old school. I like hanging flyers, but there's lots of different ways to get things out there. I just think it needs to be out there more, and maybe people could see how to access it better.
Great point. Thank you. Anybody else?
I have to,
Go ahead.
Go ahead, Jamie.
oh, sorry. I have to say that I feel very fortunate and very lucky because I feel as though harm reduction in Hamilton is very accessible, and they're very personable. We have a multitude of different harm reduction sites. One of my favorite being TAN. The only issue I've ever really had was with the YWCA. I am a former resident, and after my residency ended, I was by there, and they don't give harm reduction to non-residents, so they try to keep it in-house only, which is understandable to a certain extent, but like I don't think it's the best route for the campaign trail. But aside from that, Hamilton has fantastic harm reduction. I lost my voice recently. My apologies, guys.
No problem. No problem.
What are the challenges? I guess the judgment, like, and the looks that you could get from the people. What we need is to say the language too, like safe supply. Why don't you just say rigs, right? Like bring down the language to what's out there, and also have some humor and brought with it, right? We need to laugh because that's your medicine too. Nighttime services, I've mentioned, having gratitude, giving thanks, and just being there. Stages of change, I think, David, I think, was the one that mentioned stages of change. And that's a good program. And they didn't ask you to change. They just presented the information to you. And having services like the van, BDOT, we're just constantly out there. You're constant, the faces are constant. So, and you start to build a rapport, like with the people. And then just an inch, the width of a dime every day. And that's changing who you are to who you're going to be. And it's not permanent, what we're living right now. So change is still coming.
I would have to say the municipalities' policies, where you have one city where it's more socially acceptable than the next. I think that that makes it very challenging to get these services out there.
Trust too. We have a hard time trusting people to begin with, and this is just another layer onto it. Especially if you got children, your CAS is involved. There's police around. You don't want to do anything when the police are around. So the police also need to take a tender.
We had a thing here in Simcoe a few years back at the library. It was like an open forum about the methadone clinic. And a police officer showed up to talk. And all he talked about was how to make crystal meth. So I don't know where that led, but I hear you there. It's not all of them. There's a lot of good police officers, but there are a lot that bully and intimidate, and that needs to stop. I see it all the time in Simcoe here.
Great points. Yeah. And Jordan, I really like what you said, because there certainly is a lot of differences between place to place and attitudes. And there's a lot of people who are leaving bigger city centers, right? And they're coming to the smaller areas, and they're used to maybe accessing services a certain way, or having talking to certain people, and that doesn't always translate into some of the smaller areas where some of these programs are new. So yeah, it can be maybe a bit of a shock for people when the attitude is a little bit different. So hopefully we'll go ahead.
Also too, how like our own health clinics are like outspoken against like our methadone clinics in town. Like instead of every organization fighting for the end goal of healthcare, you have organizations that it's not happening. It blows my mind, because healthcare is exactly what it is. It's healthcare. You're taking care of someone's health. So if that simple need isn't being met, what's really going on? What's going on out there? And why do you want to fight each other? Instead put your resources to what it's meant to be. And that's it's just it totally blows my mind. Like, it's crazy, because when I was in addiction, I was like, man, I'm so messed up. I'm so messed up. And then when I got sober, I'm just realizing, like, no, there's a lot of broken things in many areas, and we all need to come together and for the better good, just, try to help out as much as you can, when it's needed. And a lot of the time, not worrying about what other people think or what people say, and just making a goal and accomplishing it the best you can. And somebody mentioned earlier in the first forum, don't get discouraged. That's the hugest thing, because me personally, knowing the pain I've caused people, that can exhaust somebody in a day. Like my ups and downs throughout one day, and how selfish I was and whatnot can exhaust somebody. So to not give up and not take anything personally, like literally anything personally, I think that's a huge thing, because a lot of times we take things personally. somebody can treat us a certain way, and that will affect how we treat somebody else. And in this profession, that can't happen, because nothing, I don't think nothing good will come of that.
Thank you for that. Yeah, very great. Yeah. Also, I just want to touch on what Charles had said too, with, you know, being old school and wanting the posters out and stuff like that. I think there's a lot of merit to that, because I think we get kind of caught up, especially during COVID, where everything kind of had to be changed to online. Not everybody has access to that. So we need to have it outside of the internet as well, right? For people to be able to know we exist. So really, really great points, everyone. Thank you so much. So the next question is, what do you see to be the benefits of harm reduction? I think we touched a little bit on that already, but certainly probably a lot more can be said there. So it's the benefits of harm reduction.
The benefits are people can start to trust again. Maybe know that they have a friend out there. Because I know when I was using, I didn't have many friends that cared. That's for sure. You know, I thought I had 100 friends, but now I can't even count all my fingers on the people that really, really care. Because you get to know people as you get better. And a lot of people are still stuck in their addictions. And I love them all. I don't judge anyone. And I used to be bad for that. The big thing for me is staying positive. And the more you stay in your head, like Jordan said, it'll mess you up. So stay out of your head. That's the best advice. Stay positive. And one other thing I just want to add is there's so many brick walls you hit coming out of addiction. You can get clean, you can go to treatment, you can go to counseling, and you can be living your best life. And then you can walk into a job interview and get told, nope. That is huge, and it can spiral you right back down. And that's where the system's broken. People need a second chance, and they're not getting it. So it doesn't always mean education. You know, there's a lot of hard workers out there that would gladly dig a ditch for 10 hours a day knowing they could get paid. It's just that chance to get paid. They're not getting it. They're being put on a program on welfare with no end. There needs to be incentives. Put incentives in the programs and you'll see change. With everything I've seen with the van, just in the last 2 months in the RAM clinic and any clinic actually, I pop in and say that and talk to people in there. And I think it's getting a little better, but we still got a long way to go. But I think we're on the right track. It just needs to be talked about more, not hidden. Don't hide anything. Put the truth right in your face and deal with it. And stay out of your head. Hate, you can live in hate. It's all in your head. So you're the one causing it. So get out of your head and things will get better. Positivity is really good. Thank you.
Just to go off of what Charlie's was saying, to provide opportunity and to have that skill development, a chance, provide some hope, like it's not the end. Have peer support workers, have them available to help you. A sober buddy, say somebody that you can just do a check-in. Am I going crazy? Or, you know, and is this real? But we also need like music and mobility to keep our balance. Wellness opportunities to meet us where we're at, but the comfort, and it might be all over the place where people need to, you know, just to see where they fit in, because we're all like a part of a puzzle. We just need to fit in our spot, but we can't like chisel it down just to make ourselves fit. And it's hard to ask for help. I know I used to make my kids, I didn't make them cry, but when they would be crying and they needed to do something, and I would say, what do you need? I would not do it until they would ask, can you help me, right? So it's asking for help is hard, and they'll make it harder. Use the language. Money's not everything. Maybe a friendship is a lot better than money. Sleeping stations. I think that's probably one thing that we'd need. Someplace to hold the personal items. The ID is a big, I'd lose my ID. Like, as soon as I got it, the next day is gone. Yeah, be consistent, and relapse isn't a bad thing. It's just a learning opportunity.
Yeah.
Personally, I love harm reduction. There was this one time where I put a needle through my arm, and it was so dull, like I said earlier, that you could hear the pop and feel the pop through my skin, through my vein. The barb actually got hooked onto my vein when I was trying to pull it out. The substance I was injecting had blue ink because I used the bottom of a pop can to cook it up. Like it's just something so small as a needle, some clean water, and a sterile cooker is such a game changer. For many reasons. For infections, you're not going to be clogging up the medical systems with people with infections, endocarditis, heart problems, things like that. You're going to help stop the spread of HIV, hepatitis C. So there's going to be so many benefits in that area. But for the users area, it made me feel loved. I was like, wow, these people care so much that they're out here grinding on the street, joking around with us, making us feel like we're involved, that we fit in with no strings attached, no judgment, no consequence, none of that. So it was just it was a beautiful thing, and it caused this relation where, whether we knew it or not, through this relationship, we looked forward to seeing these people, and we accessed these resources more and more. It wasn't like you go to the clinic, ask for some needles, and they're like, here's 10. There's a limit of 10. These people would give me boxes of needles. And in that state, that was a jackpot for me. I was like, yo, this is amazing. So, and it was just so much safer, and that's the end goal. So I love it. I think it's awesome.
Good.
I think I know what it's like to feel alone, and I know a lot of people do. And I think the harm reduction community has at least provided me a sense of belonging and a sense of family. And I feel like I have a duty and a responsibility. And I know without that, I'd probably be void of emotion. I'd probably be consumed by the trials and tribulations that I faced, which I'm still struggling with. But I can see people, and I know that there's a lot of things that we miss. And I know that people have been through a lot of pain, and I don't want to touch on all of that because I'm not trying to expose anybody's story. I'm trying to ameliorate the situation, but it's provided me people to care about, so at least I have something to take me away from my problems, So I just want to say I care about all of you guys, okay?
I love you. Hey, I love you. You're gonna make me cry. I can tell how awesome of a person you are. You can just
You're not
tell.
alone.
It's so easy to get stuck in the storm,
Yeah, it is.
And trying to figure things out. It's scary, and it's bigger than us, and it's going to take more than just the police and the hospital. It's a lot. When we come together and get all our answers and get things figured out, people are going to see how strong of a group we are.
Yep.
Thank you for sharing that. Go ahead, Deborah.
Beautiful.
Thank you for being so raw with your emotions, Jamie. This is life, right? This is real life. You have a whole community here rallying against you, everyone in the chat sending you love. And even though maybe we're not there in Hamilton with you, we are there with you, Jamie. You got a whole community here. So make sure that you reach out too. It's nice to help others, right? Yeah. But you got to help yourself too. So remember that we're here for you as well. And you don't always have to be the strong one. Thank you so much for all. Go ahead, Deborah.
I was just saying hugs, guys. Thank you for being showing your emotions and being honest with us and especially with yourselves, right?
Yeah.
Thank you. Yeah.
And I think this is a good transition into the last question. We did, I think we talked about what your advice for the for social and healthcare providers. So the last question here. So after this question is answered, if all of the panelists want to come back on, and we can take some questions from the audience, but this is, what do you hope for when thinking about how harm reduction can help people? Anyone who's accessing. So what's your hopes? What do you want to see?
Yep. I hope people feel that they can ask, that they won't be judged, that they know they're going to get proper help, that they know there's people that care. Yeah, I want to see clean, safe sites for people to do their thing. I believe in it. In my community, people always complain about, oh, there's needles in the park, there's needles in the garden. But then you say, well, let's give them a safe place. And right away, they jump down your throat on that. But I believe we can get there. You got to fight. You got to fight for what you want. And keep your face out there, keep saying what you're saying, keep telling people your story, and just keep at it. Don't give up, ever, because it is so worth it. From my experience, I can tell you it's worth it. I feel a lot better today than I did yesterday, and tomorrow is going to be even better. So that's all I can say on that, and hope everything will get better if we all work together.
I agree that hope and working together, building relationships, holding each other up, being that support system, being open and honest, and give gratitude.
I say that big things have small beginnings, and my hope would be for people to get connected to what's going to empower and ignite their passions and truly end up fulfilling their life's purpose.
Could you repeat the question, please?
Sure. Just talking about your hope for thinking about how harm reduction can help people. So like, what would your hope be for how harm reduction can help people in your community or others?
Yes, so my hope is that it can meet them where they're at, no matter what, whether, they want to get sober, whether they want to continue to use till they die. And it gives them a comfortable space to maybe possibly open up their ideas on what's going on, to help them in a way that is non-judgmental, that is easy to access. Yeah, that's it. Also, my mic was off. I think I was talking earlier. Do you recall the last comment I was on?
was talking about just like the van and just some of the ways that people can advice for people to advice for health and social providers of how they can enhance their harm reduction programs. So
Okay,
we
great.
have no, that's okay. Any last comments? I really, really love, Jamie, what you said there, how big changes have small beginnings. I think that's super powerful. Yeah, I really thank you for sharing that. So if anyone has any last comments, you can certainly feel free. And if the next panel or the first panel wants to turn their cameras back on, and the audience participants, if you want to put questions in the chat or in the Q&A box, and we'll open it up to asking questions to everyone here. I do have a few in the chat. I have a question here. I think it would be more so for the Haldeman Norfolk. Is there any movement to bring the HRAT group back together? Harm reduction group that would get together to discuss / share resources in Haldeman Norfolk. I found it very helpful prior to COVID.
Yep, I can take that. I mean, very hard to follow up with that. Thank you guys again so much for sharing. That was so insightful and empowering to hear. In regards to the HRAT group, there has been some discussion of getting it back together. I know it was such a great use of resources and a way to connect with everyone in the community and the health unit. We are starting to work towards kind of regular programming and business as usual pre-pandemic. So I believe that we have some plans on trying to implement that and get everyone back together just so that we can move forward and help in areas that really, really need it and have gone kind of on the back burner for the past couple years.
Thank you. Question more Brantford based. Is Brantford any closer to getting a safe consumption site? It's a big question.
That's a big question for sure. I would say yes, in that there is a completed application. The big piece is the location. So that's the piece that continues to be a barrier for us, because we've faced issues around zoning, landlords, all sorts of things, and we've looked at dozens of locations. But I will say the search does not stop on behalf of myself and many, many other people who are working on an application and are looking for a site. So yeah, stay tuned.
Okay. So there's a question here, stages of change program, where is it located? David, did you want to talk a little bit about the stages of change model? And then if anyone has like certain, there might have been something that got a little mixed up in there, but and if anyone wants to talk about perhaps some of the programs that people can access after David talks a little bit about that.
Yeah, absolutely. And I mean, I apologize if maybe I said it incorrectly and said program, but essentially, yeah, the stages of change, it is a model that I think a lot of programs that are created can utilize that model or base the program off of the model, or in part base it off of that model. So essentially, it's a kind of a cyclical model where you just have different stages that someone might find themselves, and some of the different stages are pre-contemplation, contemplation, preparation, action, maintenance, and relapse. So the stages of change model, is a model that can be applied to various other different areas of healthcare, and it is also applied within harm reduction. So it being cyclical, and the arrows kind of pointing in either directions, it really does kind of provide that illustration that, again, people, it really is kind of a journey, and everyone's journey is individual. Where you might find yourself today might be different from tomorrow, may be different from a year from now, but everyone is kind of in their own place. And, you know, so the programs and the resources that are applicable to one, oh, perfect. Thank you, Jamie, for sharing that. That's great. So essentially, yeah, the where someone might find themselves in one stage, the services and programs may not be applicable to someone in a different stage as well. So I think as a healthcare provider, just being mindful of that, again, hearing hearing their clients and understanding kind of where they are, and trying to provide the best resources for them at that time, is kind of I think really a huge principle of using that model of care.
Great, thank you, David. Is there anyone that has like programs, drop-in programs available? Want to talk real quick, or?
I'll put a plug in for the RAM clinic. So that's the Rapid Access Addiction Medicine Clinic. We are walk-in based, definitely operating from like a harm reduction. Doesn't matter where you are in the changes of state. Stages of change. Yeah, so it doesn't matter. We help people. We support people with many things, and those people also happen to use drugs. We can also help them with the drug use if they wish, but we help with a lot of things like case management needs. We operate both Haldeman, Norfolk, Brantford. We are kind of an amalgamation of many different agencies. So the Canadian Mental Health Association, I'm employed through the hospital, Brantford General, Aboriginal Health Center, and St. Leonard's. And then we also have like Grand River, who comes in and provides some primary care sometimes. We really do try to help people with wherever they're at. And the number one headliner is drop-in. Now in Simcoe, it's a bit tricky. We're only there one day a week, but we do our best to accommodate whatever we can do. And yeah, and then I would also toss it over to the van people to talk about that, because that's definitely kind of the pinnacle of our harm reduction in these communities.
Hey, so just in general, stages of change, yeah, I meet with folks at any part of that. And also just add to what you were saying, like we do provide referrals to folks if they are lacking in knowledge of different services in the area in which we're serving them. So if they were looking for a service, we do a lot of brochures in the van, and all of our staff are pretty well versed on what's available in Parliament, our folks, Brantford, County for folks. Generally, we will be meeting folks in contemplative or contemplative, I guess. But that's all I really have to say about stages of change.
So I'm just going to share two quick slides here in terms of some harm reduction services. So we have at the AIDS Network, we have the van that services Brantford, Haldeman, and Norfolk. So the hours are listed here along with the phone numbers. The phone numbers are call or text. So if someone doesn't feel comfortable calling, they can certainly text the information in. And then there's also the van servicing Hamilton. The hours are quite different in Hamilton in comparison to the Brantford, Haldeman, Norfolk area. Same deal though, you just need to call or text the number for harm reduction supplies, and they will meet you where is most convenient for you. So even if that's not your home, that's okay. Just give a location. So I'll leave that up for a second so anyone can take the information down. And then I also have a slide here for the RAM clinics. So the Brantford, Simcoe, Dunville, and Hamilton, where I'm not as well versed in, but here's certainly some information if you're in that catchment area and you want to call to speak to someone. There's information listed here for the RAM clinics. So I'll just leave that up for a second. So if anybody wants to take that information down, we can also, if you give us a quick email, we can share that information with you as well. So I'm going to just stop sharing that now. And then I have a few more questions in the chat box.
I would just like to add that the Brantford Downtown Outreach Team, I dropped by due to COVID, we're not accessing inside the office, but we are out there meeting people where they're at, providing harm reduction supplies, connecting them with services, meeting with the vulnerable sectors, and hopefully do some wellness work in the summertime. So yeah, we're out there. If you'd like our number, 226-227-9928, or just b.at stleonards.com.
Awesome. Deborah, if you don't mind, could you drop that phone number in the chat box so people have it available? And also, when you're out on the street, is there identifiers that people can look for to know that you're the B.Dot team? Do you have a certain...
Well, we wear our name badges, but we just connect. We're walking about. A lot of people know, like the people on the streets, they know who we are. When we encounter people, we'll say, hi, B.Dot, you know. We also have our backpacks that have B.Dot on them. Scarves that have B.Dot, toques, B.Dot, 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 B.Dot.
So look for the B.Dot.
Look for the B.Dot.
Awesome. Thanks, Deborah. So I have another question here. First of all, I just want to say a massive thank you to the 4 participants. We have lost far too many people to addiction and mental health. Your voice is so strong in all of this. My question is how the participants look at various community partners and the different silos that are put up, and how those community partners can break down those silos and be more accepting of addiction.
Is it okay? What's the definition of silo? Because I thought a silo was a lighthouse.
So basically, instead of like this agency works separate from this agency, works separate from this agency, how can everyone kind of come together? And
there needs to be more communication, because I'm realizing how susceptible and how vulnerable people are. Like I'm 32 and I'm trying to work with the shelter systems and stuff like that. And it frightens me, because I feel like what I'm learning is how shockingly rampant elder abuse either was or could be, because I'm noticing people just kind of cut corners and not really like seeing jobs fully through. And, you know, and I feel like people turn to drugs to kind of figure out those kind of situations or like relieve some traumas. And a lot of people in positions of, or perceived positions of power, are trying to put people back into the trauma boxes that they're trying to escape from. So I don't necessarily know, and I'm trying to bridge the gap. It's something I'm definitely working on and trying to communicate with people, but there's just systems and policies put in place that are ineffective, single people out, and just leave people in danger. So it's one of the reasons why I keep kind of like also circulating around those like neighborhoods and checking on my friends, because I don't want them to be just absorbed into the system without like with them having to sacrifice their individuality and having to hide traumas, you know, because that's terrible. And I don't like that. So they need to be communicating, and they need to stop like they need compassion and emotional intelligence, and they need to be able to see things through, because all they're doing is being like, it feels like they're lip service because they're not getting people housed. If this is a crisis, this is how we respond to a crisis, we're going to die. Like, we're going to die. That's that.
I don't know if that question was just for like which pay. I don't know if I can answer it, but I'm going to answer it. I think that we spend too much time in our little bubbles because there is a lot of like bureaucracy and policy and rules. And I mean, don't ever tell my management I say this, but sometimes we gotta like, don't break the rules, but like, don't be afraid to step outside of your bubble and your traditional role. Like what we were saying before, like just do it. Like, I think that a lot of ways of helping people that I've seen has been when I've sort of done something like, well, I've never done this before, and I don't know if I'm supposed to go to this place or talk to this person, but I'm just going to go ahead and call the manager of blah, blah, blah. So it's kind of like, the silos are real for sure, but we also live in them in our own heads. And then the people who live, as you said, Jamie, like in the shelter system, in the healthcare system, everywhere, they get stuck. And then also like information gets stuck. Like there's not a lot of sharing. There's a lot of repetition, and it's not helpful. So I just sort of start doing what I want, and calling, you know, and networking like this. It's great, right? Like now I know all of these faces and I can bug all of these people. I have no problem doing that. So good luck to all of you. And also Chris Haas is a fantastic example of breaking down those barriers and different silos, because I know for a fact Chris Haas goes where he's got to go. He does what he's got to do. And so Chris, you should be telling us how to do it.
It's a lot easier to ask for forgiveness than it is permission. So
yes, but don't tell my management I said
that.
Well, and I think looking at somewhere like the RAM clinic is really a good example of how we're trying to break down those silos, right? Like there is multiple different organizations located in one building trying to help provide care together for a certain population. And then, so that's really like a prime example of how we're really trying to break down the silos and trying to promote collaborative care in our community. And then the brand new program here at the hospital, it's really only a 2-man program right now, which is myself and a case manager from St. Leonard's, but it's really showing that we're working collaboratively with another agency to try and break down those silos and provide more collaborative and comprehensive care to clients who present to the emergency department in the hospital, and really trying to make sure that those bridges are built back to the community supports, and that those silos are broken down essentially, and that we don't have those. So I think those are two really kind of good examples that are on the forefront in our community and hopefully kind of gonna push forward more.
It's also like, it's really frustrating for like some people. There's another commentary on the shelter system. It's like, I've gone in and like given my information, and then somebody new comes along and they're like, okay, like, can I get your name and everything? I'm like, I already gave the person my information. And it's messed up because I'm seeing the disconnect of communication from one employee to the next. And I don't know if it's not me harping on linguistics or freaking the chain of command, but like if it's people trying to like, if we're trying to train French people or Spanish people, or we're trying to train everybody, I need to know. But if people no longer have like control or like a hold of the language, I can be a little bit more forgiving if I know what level they're at. But these simple things that should be taken care of really easily. And I don't mean to come into people's offices and just be a crappy apple and like have a bad day, because I can get through my bad day. What I can't get through is lack of education and not knowing if people can still speak English, or like what intelligence level we're at, because people having to constantly go into places and repeat themselves gets really frustrating. Like it boggles my mind, and then I become destructive.
great point. I mean, every time that you go to a different agency having to say the same things over and over again, I mean, if there was a way, I mean, confidentiality certainly puts a monkey wrench in that, but if there was a way that things could be shared, so every time you went in, you didn't have to kind of almost start from the beginning, there certainly, I think, would be a lot of merit to that. So
relive your trauma, basically.
yeah, great point, Jamie. Thank you.
If I could answer Chris's question for breaking down the silos, my best opinion on that is a mouth of a lion and networking, like just being very bold and just continuously networking, because I think there's more power in numbers, and the more yeses and the more people on board with harm reduction kind of plant seeds maybe in softening other people's views on it.
Great point. Thank you, Jordan. So just for people who are following along in the chat box, I do want to say that Tess has dropped some information that's Halton specific in there. So if you're joining us from the Halton area, there is the public health area does operate a van Monday to Thursday, 2 to 6 p.m. in the Halton area as well. The information, the phone number is in the chat box that should be accessible to everyone if you want that information in the Halton area. And she also shared a link for the Halton RAM clinic. So if anyone is in the Halton area and want to access that, please look in the chat box because it is there. And she did also remind me that the AIDS Network is currently hiring and expanding in our harm reduction program. So if anyone is interested, we can certainly share that information. And that their AIDS Network does have a Halton worker for harm reduction as well. Also, Deborah has dropped the information for the BDOT in the chat box as well. That is accessible for everyone to see. If anyone wants that information, it is there as well. And I feel like there was another question in regards to the RAM clinic asking if they will be expanding their times to meet client needs, evening, weekend hours, for example.
I think you're talking about the Brant Haldeman Norfolk RAM. So we do in Brantford have a longer day. So Tuesdays we operate until about 6 p.m. and that's in terms of our funding, kind of we shifted hours around so that we could accommodate that kind of, individuals who are working or who need access in the evening. At that point, that's our in-person evening access. We do a lot of phone and virtual support, and we're often pretty willing to accommodate. Now I know that means that you have to have a phone and access to virtual, but we kind of do our best to accommodate when people can't come in exactly during the hours that we offer. The RAM phone line is often answered over the weekends and into evenings by some of our staff. But at this point in time, I'm not really sure if there is any like concrete plans, and a lot of that is kind of limited by our funding at this time. But certainly a 24-hour RAM clinic would be like, that's my dream, to be honest with you, because addiction and substance use doesn't stop at 3 p.m. on a Friday. In fact, it's usually, that can be some of our riskier times because everything else is closing over the weekends as well. So that's in terms of the RAM clinic, what our availability is like right now. But I would certainly encourage you to contact the information that was posted on that earlier slide that Jamie put up and say, verbalize that weekend and evening access would benefit the community, and it always goes somewhere. So that's what I would encourage you to do.
Great, thank you. I'm just wondering if because we had mentioned earlier that any of the participants could like reach out to panelists if they had any questions, or if anyone feels comfortable, do you mind dropping your email in the chat box, just so people know where they can reach some of you to get some answers after this is done, because this is just the beginning of the conversation. I'm sure there's, you know, after people leave, there'll be a lot more questions, things that they think about, reflect upon. So if they have someone they can reach out to, that would be great. I do have, it's from Chris here. It's just more of a comment. It was amazing to have this diverse group come together to share their experiences, whether it is providing services or accessing services. These conversations are critical in moving forward. Thank you all to the participants for sharing their experience. So that was just a nice little comment that we had there. And if you have the time to go through the chat box, lots of really great comments to the panelists, lots of well wishes and thank yous. So if you have a second to go through, I would recommend just going quickly here to see if there is anything last minute. I think that's all the questions, mostly just thank yous in the chat box right now. So everyone, thank you so much from the bottom of my heart for spending the time with us this morning and chatting. What great conversations, what great experiences and feedback that you all provided. Please reach out if you want to debrief or talk about anything. I know that it was heavy conversation today. So please, if you're struggling, reach out, talk to us, talk to someone that you feel comfortable with. And I will just say to the participants that Jillian will be sending out a link. It's just a little bit of a feedback survey. It's not necessarily specific to just today's workshop. There's some general information in there, but if you can give it only take about 2 minutes to fill out. So if you can fill it out, it would be much appreciated. And other than that, again, everybody, thank you so much for today. It was fantastic, and can't wait to see you in the community.
Thank you, guys.
Thank you, everybody. Have a wonderful day.
You too.